Hello everyone. Thank you for joining us today for our webinar entitled How the Great Lakes Practice Transformation Network Can Support Your Quality Improvement Efforts. Today's presenters are Brad Carson, GLPTN Provider Recruitment and Outreach Coordinator, and Christy McDermott Avery, Quality Improvement Program Expert. My name is Liz Jones and I am today's moderator. Before we begin, I have a few housekeeping items to touch on. We will be keeping the phone lines on mute during today's webinar. If you have a question during the presentation, please type it into the questions box in your GoToWebinar interface. Various GLPTN program leadership are in attendance today, so we will all take time at the end of the presentation to answer any questions you have. If for some reason we are unable to get to all of the questions, we will email you directly with an answer following the broadcast. A copy of the GLPTN Letter of Participation and Participant Demographic Information Enrollment documents are available to download through the GoToWebinar interface, and they are available on our MCEDA website at www.mceda.org/GLPTN. We will be posting a recording of today's presentation on that website as well. With that, I will turn things over to Brad.
Good afternoon. Welcome and thank you for attending today's introduction on the Great Lakes Practice Transformation Network, working through the puzzle pieces to help you reimagine your future. So, just what exactly is GLPTN and how does it relate to what you may be already doing? The Great Lakes Practice Transformation Network, or GLPTN, is a new federally funded technical assistance program to help medical providers achieve their quality improvement goals. This program will be available at no cost to both primary care and specialty medical providers and their office staff. There are 29 practice transformation networks across the country funded under the brand new CMS Transforming Clinical Practice Initiative. The GLPTN is a 3-state coalition made up of 32 healthcare partners, including 4 regional extension centers, 3 state departments of health, 5 health information exchanges, and 8 universities, including Indiana University, Northwestern, and Purdue. The GLPTN efforts in Michigan will focus on providing high-value, clinically relevant, and cost-efficient assistance to 4,000 clinicians in the pursuit of patient-centric practice transformation. Altarum is the lead organization for the state of Michigan in partnership with the Michigan Center for Rural Health and Upper Peninsula Healthcare Solutions. The GLPTN is a 4-year initiative running from October 2015 to 2019. The aim of this large project is to support organizations through healthcare quality compliance, transition to value-based care, and engage patients to be responsible healthcare consumers. Who can participate? Medicare and Medicaid providers in primary or specialty care, including mid-level providers who work in ambulatory care settings. Providers are excluded if they participate in Pioneer ACOs, Medicare Share Saving Programs, Next Generation ACOs, or the Multi-Payer Advanced Primary Care Program, or MyPIC, as is more commonly known in Michigan. Providers are also not able to participate in more than one CMS-funded PTN. So why is it crucial for providers to participate in the GLPTN? At this time, I'd like to introduce my colleague, Christy McDermott Avery, who will explain some of the changes in health today and how those changes make GLPTN services especially relevant.
Thank you, Brad. To begin, we'd like to convey the importance of why providers should take advantage of the opportunity to participate in the GLPTN. The clock is ticking. Health insurers are relying increasingly on quality metrics to reimburse providers. Whether you're a pediatrician participating in Blue Cross and Blue Shield of Michigan's PGIP PCMH program, a physician looking at recertifying for boards, or a Medicare provider participating in PQRS or meaningful use, it's expected that you're involved in quality improvement activity and can demonstrate this with EHR data. On April 15th, 2015, the Doc Fix Bill, or MACRA, the Medicare Access and CHIP Reauthorization Act, as it is more formally known, repealed the flawed sustainable growth rate, or SGR, used to determine physician reimbursement and replaced it with a new pay-for-performance program. This is the first time in the history of the Medicare program that Health and Human Services has set explicit goals for an alternate payment model and value-based payments. Medicare has set a goal of tying 30% of payments to quality or value through alternative payment models, such as accountable care organizations, or ACOs, advanced primary care medical homes, or bundled payment arrangements by the end of 2016. By the end of 2018, 50% of payments will be tied to these models. One of these such value-based payment setups is the MIPS, or Merit-Based Incentive Payment System. The MIPS score will rely heavily on performance measures. Historically, CMS has taken data from 2 years prior to tabulate penalties. Information from where providers stand with their meaningful use, PQRS, and value-based modifier quality metrics from 2016 data will determine what reimbursement will be in 2018. This is one reason why time is of the essence and why the assistance is being offered now, despite MIPS adjustments not formally starting until 2019. Beginning in 2017, providers will be annually measured in 4 performance categories: meaningful use, PQRS and value-based modifier for quality, value-based modifier for cost, and clinical practice improvement. This is what makes up the MIPS score. Provider quality metrics and MIPS scores will be posted publicly online on the CMS Physician Compare site for all to see. The MIPS score will be between 0 to 100. Those providers scoring 49 or less will be penalized. Those scoring 50 will be neither penalized nor rewarded, and those scoring 51 or higher will receive an incentive bonus. Progress made in 2016 through 2018 will determine what providers get paid beginning in 2019. The best thing an organization can do, because 85% of the MIPS score is based on meaningful use, PQRS, and value-based modifiers, is to improve how these 3 existing programs perform and are managed in your practice now over these next couple of years. In 2019, the maximum bonus a provider could be eligible for, or the exceptional performance bonus, which is for those providers that exceed the top 25th percentile of all MIPS scores above the performance threshold, would be 12%, though it is more likely to be not more than 4%. The maximum penalty would be 4%. These amounts go up each year, leveling off in 2022, with the penalty not being higher than 9% and the possible bonus being at 9% as well, with the potential for 27% with the exceptional performance bonus. Much is up in the air, as CMS still has yet to determine how they will put the MIPS and Advanced Payment Model, or APM, tracks into operation. Once CMS communicates these details, the GLPTN will receive the information, interpret it, and disseminate it, assisting participants accordingly. Patient-centered medical home also figures prominently in MIPS. PCMH certification requires demonstration of ongoing, continuous quality improvement. The GLPTN will help practices with aligning what they've accomplished with PCMH to satisfy MIPS requirements. Another very significant factor that supports the need for GLPTN services is the 2014 national study. Physician burnout has climbed 10% in the previous 3 years to an average of 55%, an all-time high. Burnout is one result of many complex changes unfolding in healthcare. A few of the trends contributing to the chronic fatigue many physicians experience include the shifting payment model from fee-for-service to pay-for-performance, the eminent physician shortage, an aging population in need of more care, changing patient expectations, increased transparency, changing technology, shortage of sleep and long hours, and too much time on administrative tasks centered on the multiple incentive programs. Physicians also feel they spend far too little time with their patients. The GLPTN will help providers to be able to work smarter and not harder, increasing the odds of being able to capitalize on those MIPS bonuses and avoid penalties. We can also help align reporting for programs that have at times felt to be at cross purposes. I'll now pass this back to Brad to discuss the GLPTN program and services in more detail. Brad?
So what does the timeline for year one of the GLPTN look like? The program was launched October 2015. Currently, providers are being enrolled. Tools and materials are being finalized along with CME, MOC program options, and pre-assessments are being completed for those practices that have already signed up. Spring 2016 will see quality improvement advisors engaging with the practices and identifying quality improvement goals. Summer of 2016, practices will begin receiving direct support from their quality improvement advisors based on the specific goals identified. What can practices accept in terms of the delivery of technical assistance? GLPTN technical assistance services will be delivered to practices by a dedicated quality improvement advisor skilled in customizing support to meet a practice's unique priority and needs. Quality improvement advisors will get to know the practice's current state and QI priorities and goals, beginning with an initial assessment. This will help the practices understand and align their QI focus areas with existing incentive and reporting programs. GLPTN services will include such things as a dedicated quality improvement advisor for customized support with current goals and programs you are already participating in. PQRS and value-based modifier participation will be supported. Assistance with transition of care documentation and billing codes will be received. Workflow evaluation and coaching to improve office and clinical efficiencies will happen. Provision of practices and procedures for optimizing EHR use for data-driven quality improvement. Provision of educational resources on upcoming reimbursement changes. Free CME MOC Part 4 programs. Initial programs are under development for medication adherence and depression screening that will be worth up to 30 CME credits. Additional programs will be available in the future. Coordination of support and alignment network offerings available to PTN providers. In addition to PTNs, CMS has also funded 10 professional organizations, such as the AMA, who will be providing support throughout the project. The GLPTN offers customized support. We will work with you to select quality measures that are of interest and relevance to your practice. Key focus areas of the GLPTN include increased medication adherence and safety, a decrease in unnecessary testing, an increase in preventative services, an increase in behavioral health care, improvement in chronic disease management, and a decrease in preventable hospitalizations. The things that would be expected of GLPTN participants include regularly communicate with your assigned quality improvement advisor, ensure providers stay engaged and act as clinical champions, track and monitor progress of assigned tasks and/or deliverables, share aggregate data quarterly on selected quality measures, work with quality improvement advisor and practice team to identify opportunities for improvement, learn about basic PI tools and techniques to drive and sustain improvements, work with providers and staff to solicit and input ideas relating to performance quality improvement, participate in PQRS and the value-based modifier program if eligible. So what we want you to understand is that these activities will be accomplished on your time, in your space, based on your unique priorities, and on your terms. We want you to get you here, and the best way to do that is by helping you put all these pieces in place. The GLPTN is committed by helping providers more effectively demonstrate the quality of care they're already providing, ultimately making for better quality of life for patients and providers alike. A reminder that this assistance is free. To verify your eligibility and reserve your spot, complete the letter of participation and participant demographic information enrollment documents, which you can download directly from the GoToWebinar interface or from www.mceda.org/?GLPTN. These completed documents can be emailed to Brittany Henderson at brittany.henderson@altarum.org. We will now take any questions you may have. As a reminder, please type questions into the question box in your GoToWebinar interface. Thank you for your time and participation today.
If you have more questions about the GLPTN program, you can direct them to Brad Carson. His contact information is listed on this final slide. And if you have any questions regarding the enrollment documents, you can direct those to Brittany Henderson. Thank you everyone for attending and have a great afternoon.